along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Hello, everyone. Good morning. From across the world, we've all gathered here this Saturday morning to actually enjoy what it means to seek for knowledge. For knowledge is power. And a big shout out to everyone out there. Today is International Women's Day. We want to say a big thank you to our she heroes, our fellow men who are co-drivers in this struggle, so to make sure equity is the hallmark of the day. And to all of us amazing women out there across all generations and across all climes. Please, please, if you are here with us, put a clapping hand in the chat box. Thank you. Well, today we are going to be talking about something that is very, very topical. It's women's health and chronic kidney disease. My name still remains Dr. Loretta Oduware Ogborooko, consultant obstetrician and gynecologist, and women's health advocate, amongst many other things. So it's really exciting to see someone today come to talk about something that affects my neck of the woods. Dealing with women, it's not easy. But there is also research that has shown that chronic kidney disease is something that affects women a lot more. Data has shown that. And how our hormone has a role to play, pregnancy has a role to play, very interesting physiology and the way it changes has a role to play in all of these. To tackle this subject matter today is no one that is someone that you all know, someone who has the background knowledge to throw light on this subject matter. He's a global kidney health facilitator now for over 15 years. He's a consultant renal physician and honorary visiting professor in Manchester, professor of medicine and medical education in the University of Port Harcourt. We have none less than Professor Ibi Erekosima with us today. I'll yield the mic now so he can do justice to this subject matter. Welcome, Professor, and welcome to everybody in the audience. It's not too late. Invite a friend to invite a friend. Thank you.
Thank you very much, Loretta, for that kind introduction. So I'm going to share my slides. Today is Women's Day. I have two ladies in my house, my wife and my daughter. And so I know how important they are to me and all that. So I'm going to share my slides now. And then I will start the presentation. If you can see it, could you just give me a thumbs up? Okay, so you can see it, so that is very good. So today, what I want to talk about is women's health and kidney disease, understanding the challenges and solutions. Loretta has alluded to the fact that women, which is very correct, women have a higher prevalence of chronic kidney disease compared to men, and they have a complex physiology, and they also go through pregnancy and all that. So, and also go through menopause. So, all those can have impact on the disease. So this is my outline. So I'm going to make it as understandable as I can for you to get along with my presentation. So I'm going to introduce and talk about kidneys in health and disease, and look at the role of women, the impact of kidney disease on women's health, and look at general treatment and management, but more importantly, prevention and awareness, and conclusion and takeaway messages. So just to understand what kidneys are. So the kidneys are two bean-shaped organs. They're just positioned at the back, just midway at the back. And it weighs about 150 grams in males and about 135 grams in female. Does not mean that in males it does better work than females. It doesn't mean that. It's just the way nature has built it. And so they usually, if you take a fist of your size of your fist, you just put the size of your fist. And two key things that it does is ensures that your body chemicals are balanced, and it ensures that you get rid of toxins and unwanted chemicals. Now, what is interesting here is that there are 1 million filters in each kidney. We call them nephrons. But just put in your brain that you have filters, 1 million filters in each kidney. And your urine output per day should be around 800 mils to 2 liters. 2 liters, if you take a big water bottle if you go and buy a big water bottle of 2 liters, about that size. So just bear in mind, that is what the kidney is like. And so just to break it down, if you slice the kidney into two, you see some kind of redder areas, about 7 areas, and that's where the filters are situated. And if you take if you just look at it under a microscope, this is the way a filter looks like. So blood comes in, it filters it in this regularly structure here, and it filters the blood, and then the good things go back to the body, and then the rest goes to the bladder and is stored and it passes urine. And so this is what really happens. Blood goes in, blood goes out. So it gets filtered, which I showed in the last, the cartoon I showed in the last slide. And then finally urine drains out and it gets to the bladder and you void it. So this is the healthy kidney and the blood filtration process in simple terms. And so the kidney doesn't just do excretion and getting rid of all waste products. It does other things that are quite important for your survival. It ensures that there is not too much water in your body, so you create body water balance, and then it's a seed for control of blood pressure, and that's why when you have kidney disease, your blood pressure goes up. But sometimes chicken and egg hypertension causes kidney disease, and vice versa. So it activates vitamin D, which is responsible for the health of your bones. It ensures that the acids and base in your body is well balanced, and that with the balance of the salts in your body, it helps maintain healthy hearts, and also it helps it stimulates the bone marrow to make red blood cells. And so those are the things that the kidney does. So the kidney, like I said, doesn't just get a waste product. That's why when you have a kidney disease at advanced, patients are usually very sick. So just in a broader context, kidney disease can be acute, which means that it is reversible. Sometimes when people are dehydrated, very dehydrated, they have infection, sepsis, and those are the two main causes of acute kidney injury, and it's reversible. Now, the other one is chronic kidney disease, which the disease progresses through several stages, and it's irreversible. And that's why you need to be aware or have to look after yourself. And so the different stages of chronic kidney disease have different approaches to management. And so just know that acute kidney injury that is reversible, you get back your kidney function, but chronic kidney disease is progressive, gradually reducing your kidney function. So what is chronic kidney disease? I haven't said that. Is that it's lasting damage to the kidneys that gets worse over time, and it means damage to the kidneys over time. There's filters are damaged progressively, and so when what we define as chronic kidney disease, when we find that structurally and by function your kidneys are not abnormal for more than 3 months, we will now say that you have chronic kidney disease. That's what we used to define chronic kidney disease. So if you look at what happens to the kidney in chronic kidney disease, you can see the kidney that is diseased, the kidney that is good. So there are two different appearances. You can see that. And so this is what happens. Healthy kidney, you can see that all the good things that are filtered are kept away, get back to the body, and most of the bad things, you can see that are still in the urine. You can see that the filters are now irregular and all that. That's what happens in chronic kidney disease. I showed you the Wrigley structure in the last few slides. And so what are the causes of chronic kidney disease? The two main causes of chronic kidney disease are diabetes, hypertension, high blood pressure. And so also inflammation of the kidneys due to infections and all that can be a cause. And so, but just the takeaway message, the two main things that we should be aware of it is diabetes and high blood pressure. And diabetes is the current cause worldwide. So I made it simpler here: diabetes, hypertension, inflammation of the kidneys, and polycystic kidney disease is the commonest genetic kidney disease. Very rare, but it happens. It's not common among Black people, but it's common here among Caucasians. And so I put this, you can see that diabetes, hypertension, and CKD are intertwined. They're woven together. And so diabetes and and hypertension are Siamese twins. Either of them will affect your kidneys. But I once said that there are other things that we from our own background like to do. We like to buy herbs from local herbs, thinking that will help our bodies. But be aware that it can cause toxicity to your kidneys and cause kidney injury. So, and most of these webs, they don't have those and things. So people have asked me all sorts of questions in my last good number of years I've done this presentation. But my advice is that you should try and avoid herbs that you don't know where they come from. So also buying over-the-counter drugs, the ones that are more important that people buy is painkillers like non-steroidal anti-inflammatory agents. Ibuprofen is good for for relief of pain, but it is not great to have it consistently, because over time it can damage your kidneys. And there are other things that you can buy over the counter that can affect the kidneys. So always discuss with your doctor before you go and get all these medications. So what is the statistics about this whole story? I put this the impact on women, role of age and socioeconomic factors. Now, statistics have shown that women are disproportionately affected by certain types of kidney disease, and also including age, race, and socioeconomic status, which play significant roles in these demographic factors. So we should be aware that, for example, hypertension is commoner in Black people. So hypertension is common cause of chronic kidney disease among Black people. And Black people are more likely to end up on dialysis compared to their Caucasians if they have the same disease. So how common is this worldwide? And it is known it is recognized by the WHO that it's a leading public health problem, especially with the almost an epidemic proportion of diabetes and hypertension in our communities. And it poses a substantial health burden. The UK always cry out in terms of how to deal with the outburst of obesity, poor lifestyle, and all that, which are all all trigger factors for hypertension and diabetes. So chronic disease affects, you can see 16% of the world population. That's a lot. And so that's something that we need to be aware of. And the global estimate of prevalence, which is the presence of the kidney disease, is about 13.4%. It's quite high. But in the UK, there are 3 million people who live with chronic kidney disease. I've really struggled over many years. I've been in renal medicine in this country for the last 25 years, and it keeps expanding. I look after Greater Manchester. And so I said 3 million people have chronic kidney disease, but around 63,000 people are being treated for kidney failure. And kidney failure, I'll show you some in future slides, and the stages of kidney disease. And the most important information here is that Black, Asian, and minority ethnic groups are 5 times more likely to develop CKD than other ethnic groups. So that's the take-home message. And this information is on the website of the Kidney Care UK. So coming to women, so that is what we're celebrating today, Women's Day. So we should be able to be aware of some of these problems, specifically in women. So prevalence of chronic kidney disease in women, globally estimated that the prevalence is higher in women than in men, which at the beginning of this talk, even the moderator did mention that from widespread knowledge. And she's an obstetrician, so she probably knows that this is common in women when she's dealing with her patients. So this you can see is 14%, 14.6% versus 12.8%. And the segment is varied between women and men across ethnic groups. It's the same thing, whether it's Black, Asian, or Caucasian. And so this is a cartoon just to remind you that people aged 65 through to 74, it is made that 1 in 5 men and 1 in 4 women have CKD. Just that is the thing that I want you to remember. So as a follow-up to that, you can see that sex and gender differences in CKD. Women are more likely to have CKD, which you have mentioned before. Men are likely to die due to CKD because they have a faster progression. I don't know why, but there have been a lot of studies done, but nobody has really known why epidemiologically that is the case. But women with kidney failure have greater excess risk of death because, one, if they're pregnant, if they have if they have other associated autoimmune diseases and all that, they're more likely to die in terms of other comorbidities in addition to kidney failure. And also, it's been found that women have less awareness for chronic kidney disease. I don't know why, but that's what studies show. And it's in the American Journal of Kidney Diseases blog in the commentary. And it's also in other commentaries. But females, like I said, females have more autoimmune diseases that inflame the filters of the kidneys than men. And also females have greater risk and prevalence of kidney stones because probably they drink less water and because they are more prone to infections, urinary tract infections because of the short urethra and all that. So these are some of the things that make CKD more prevalent in women. And so just as more detailed on this, in access to medical care and data lacking to evaluate extent of differences, that's one of the things. But most of the studies that I've shown are more showing that CKD is more in women. And this is because, pregnancy is unique. They have autoimmune diseases, and flow of autoimmune diseases also cause that problem. And less women than men are on dialysis because more men end up on dialysis than women. And women are less likely to be transplant recipients because they are less likely to end up with end-stage renal disease. But it's also found that women are more likely to donate their kidney. I've seen it in my practice, that women come forward more than men to give their kidneys, and of course, because of their general make as women. So risk factors specific to women, which we did mention at the beginning, women face unique risk factors for kidney disease, including hormonal changes, pregnancy-related complications, and certain autoimmune diseases like lupus, which is very common in Black women. And also urinary tract infections. Women are more prone to urinary tract infection than men, especially in postmenopausal women. So understanding these can aid in prevention and management. So just to summarize those risks for women, so women's health is unique, which we all agree to that. One thing that we know for certain is that women of childbearing age face different problems than men when it comes to kidney disease, which I've alluded to in the last few slides. And so women with CKD are generally discouraged from using the pill as a birth control method due to a greater chance of an increased blood pressure and blood clots that make kidney disease worse. And women with CKD may have more problems with pregnancy, causing increased risks to the mother and the child. I've seen that. And so we really need counseling before pregnancy has to be really planned so that the obstetric and nephrology acts as a team to look after you. Even women without CKD may be at risk during pregnancy and birth because of preeclampsia, another problem that increases blood pressure and put a strain on the kidneys. Prenatal care is therefore crucial for pregnant women for this very reason. And preeclampsia high blood pressure when pregnant can lead to kidney failure and the risk of CKD later in life. And that's why in some women, we always advocate that we have long-term follow-ups, because there's enough data to suggest that in some women, if they have preeclampsia, they will have chronic kidney disease in the future because they will still leak protein. So the common trigger causes, which I've mentioned before, diabetes, which is the major cause, and hypertension's role. Additionally, whether it's men or women, diabetes and hypertension is generally a cause. Additionally, lifestyle factors and certain medication can trigger or exacerbate these conditions, which can affect both sexes. So these are common triggers that I need to make you aware, which I've mentioned in the previous slides. So how does this impact directly on I want to go into more details of impact of kidney disease on women's health. So kidney disease typically impacts various aspects of women's health, including reproductive health and emotional well-being. Understanding these effects is vital for comprehensive care. So it is important that we understand what effects it has on reproductive health. So if it has impact on menstrual cycles and can disrupt normal menstrual cycle, leading to irregularities that may affect a woman's health. It also affects fertility. Most of our dialysis patients have secondary infertility because they can't become pregnant. Even when they get pregnant, the risk of pregnancy far outweighs the benefits. And so reproductive health guidance. So women with kidney disease require appropriate guidance to manage their health effectively. So if you have chronic kidney disease and you're young and you're still in reproductive age, you need to really have good counseling with your doctor, with nephrologist and obstetrician to be able to guide you with a planned pregnancy. So we do know that these complications arise when women get pregnant. When women with kidney disease get pregnant, they face increased risks during pregnancy, hypertension, preterm delivery. And so this is what I've said before, the collaborative care between nephrologists and obstetricians is essential for optimal care. So this brings to the next point, which is psychosocial emotional impacts. Of course, I've seen it so many times in my patients, female patients, that these have a real huge emotional burden or psychosocial burden on them. And so women diagnosed with kidney disease often experience anxiety and depression, impacting their overall well-being and treatment difference. And that's why we signpost them to psychologists. We have psychologists in our department as part of the holistic care. And so social isolation can also occur due to the challenge of managing kidney disease, leading to a feeling of loneliness and disconnection. And so holistic care is very important, which I've mentioned before. So that is just the way it affects women specifically. Now, let's go to the common pathway of what happens to the kidneys when you have chronic kidney disease. We have 5 stages of chronic kidney disease. 90 when it depends on the kidney function, that's how we stage it, and that also impacts on treatment. And so if you look at stages 1 to 3, there are no specific symptoms, but kidney function can slowly decline. And kidney function is very low, and treatment for kidney failure may be needed in stage 4, which is between 15 and 29%. But less than 15% begin to plan the future in terms of supporting dialysis and affording the patient kidney transplant. And so this is what happens, what it means when they say that your kidneys are in stage 1, stage 2, stage 3A, stage 3B, stage 3, 4, and stage 5. So the areas that that concern us more. Most people who have stages 1 to 3 don't even know that they have the disease, especially when they don't have any symptoms. And so we begin to have the complication of kidney disease, which is that, anemia, bone disease, and all those things that the kidney does, which I showed in the normal kidney function at the beginning of this presentation. So the last stage is stage 5, where most severe kidney damage, kidneys are very close to not working or have stopped working, have failed. So what we'll do is that we'll plan, and dialysis does not take place until kidney function is less than 10%. And just be aware that the dialysis machine just does 10% of the kidneys function and keeps patients alive 3 times a week. But kidney transplant is the most definitive treatment for kidney end-stage kidney disease. So this is just a cartoon to just help you understand the symptoms don't occur until this. Most of these don't really occur. Most people have all this history, these symptoms put here as in stage 4. So those are the things that you should be aware of. But most times, stages 1 and 2, and even 3, they don't have symptoms. And so what are the common symptoms? Kidney disease can be a silent killer with patients not experiencing any symptoms until late stages. And that's why you need checkups, especially when you're above 40. And so these are the loss of vomiting, loss of appetite, leg swelling, but the most important thing, itching, your urine is frothy and all that, sleeping difficulties and muscle aches and pains. And so the kind of tests we do blood tests to check your kidney function, and creatinine and urea, using creatinine and urea to assess your kidney function. And we test your urine for protein, and that's directly correlates to the progression of your kidney disease. And we do ultrasound scanning by way of imaging. And in certain situations where we think that there's inflammation in the kidneys, we do a kidney biopsy where we take a tiny piece of tissue from your kidney and then look at it under the microscope, so that we'll be able to give the patient immunosuppressants that we use to treat this inflammation. So that brings me to the point that the importance of early detection. I was giving you the background of what kidney disease is, how it affects women, and also how do we detect it early. Early detection of kidney disease is vital for preventing progression to advanced stages. And so regular screenings and being vigilant about symptoms can lead to timely interventions. And these day and age, there are drugs that slow progression, there are drugs that protect the kidneys. So early detection of kidney disease is essential to prevent progression to more advanced and serious stages. And so regular screenings can help identify kidney issues before they become severe. And so be vigilant about the symptoms. And most times, like I said, some people can begin to ask me, what are the CAHN symptoms that you know? Most times there are no symptoms. So some patients, you have high blood pressure, which may cause the kidney disease, and vice versa. And you may have ankle swelling, and your urine will be frothy and all that. So regular checkups is so important. Women with risk factors for kidney disease should have regular checkups to monitor their kidney health. For example, if you've had pregnancy with preeclampsia, I would suggest strongly that you check your kidneys every year. And then preeclampsia is hypertension in pregnancy, and you have proteinuria, and other things can happen, associated with that disease in pregnancy. And so this proactive approach allows for adjustments in treatment as needed. So the main crux of this talk is prevention and treatment. So prevention is what is the main thing. So there's no cure for chronic kidney disease. That is the sad aspect. But we can slow the progression. So treatment can help relieve symptoms and stop it getting worse. Treatment will depend on the stage of your kidney disease. And the main preventative measures are managing risk factors, regular checkup, especially when you're above 40, and lifestyle changes. So it is not rocket science, it is basic stuff. So what are these? So I always say this, and I always say this anytime I give this talk, so that preventing chronic kidney disease and ounce of prevention is worth a pound of cure. Also, diet and exercise to maintain a healthy weight, which we'll sing about. There's so many stuff going on in the social media. We talk about smoking cessation. We talk about if you're diabetic, you need to control your diabetes, control your blood pressure, control your cholesterol, avoid excess over-the-counter pain medication, ibuprofen, etc. And regular checkup with your primary care physician, especially when you're above 40. So an ounce of prevention is worth a pound of cure. So the lifestyle and dietary changes, these adopting a healthy lifestyle, including a balanced diet, regular exercise, and maintaining a healthy weight, can significantly impact kidney health and overall well-being. And so even we have a program within our kidney network where we call BEAM, which you have access to help to lifestyle changes and health, maintaining a healthy lifestyle. So that is quite important, and that is something that you do yourself, which, I mean, you got to have motivation to do that. And so medications may include to control the blood pressure and manage your diabetes, and therapies may also involve addressing underlying conditions contributing to kidney disease. For example, if you have lupus, we'll treat the lupus nephritis, which is inflammation of the filters. So when anybody says nephritis, nephron is the filter, itis is inflammation. So inflammation of the filters, which I showed you at the beginning of the talk. So diabetes management and other therapeutic approaches, which include protecting the kidneys in terms of slow progression of chronic kidney disease. So what do we do as kidney doctors to reduce progression? One, we make sure that we treat diabetes and hypertension very well in liaison with the patient, because it's a joint care. Reducing protein in the urine, we give medications for that, because protein in the urine is also a risk factor for the damage. Also, lifestyle modification, and avoiding over-the-counter drugs, and getting regular checkups from your kidney physician. I just wanted to show this to you so that this will be something that you will share you up, that women have lower risk of CKD progression, which I showed before. This is a research that was done in Sweden. And women have lower risk of mortality before dialysis, which is which I did mention before, they less progress. That's why they don't want on, and they have lower cardiovascular mortality risk, especially when they are premenopausal, because of hormonal protection. So this is what we do once you get to the point where you have advanced chronic kidney disease. We now begin to plan dialysis and kidney transplant. And so there are two types of dialysis. One is hemodialysis, in which you go to the hospital, they clean your blood through a machine 3 times a week, or you do it yourself at home, where you put fluid into your tummy. The lining of the tummy now acts as a filter to get out the impurities. But finally, the ultimate treatment is kidney transplant. And so this is it. This is the peritoneal dialysis, this is hemodialysis, and this is kidney transplant. Kidneys are usually transplanted in the groin. We don't take out the native kidneys, we leave it there, except it's causing problems. Either it is too big to get a space to put the kidney transplant, or it has been causing recurrent infections. So it doesn't affect the transplant kidney. And so understanding these options helps patients make informed decisions about their care. So just to wrap up, this is the last few slides, prevention and awareness. And so preventing kidney disease involves lifestyle modifications, education, and awareness initiatives aimed at reducing the risk factors and promoting kidney health. So adopting health habits are staying hydrated. I mean, people don't drink enough water in this country. Maintain the kidney function by flushing out toxins and preventing kidney stones. And limiting salt intake, lower your blood pressure and decrease the risk of kidney damage over time, and manage your chronic conditions of diabetes and other conditions that may be causing your kidney disease. So there are a lot of resources with the Kidney Care UK, the National Kidney Foundation. On their website, you have educational resources and support groups, and the importance of educational resources. Access to these resources, to educational resources and support groups, is vital for women affected by kidney disease. That helps a lot. And these resources can provide information, emotional support, and a community of shared experiences in this. And And there are where women can connect, share stories, and find encouragement from others facing similar challenges. So this is where CAHN comes into play, advocacy and policy initiatives, where they are the ones that shout and let the policymakers hear what is going on. And so advocacy for kidney health involves promoting policies that support research, awareness, and access to care for women with kidney disease, and collective efforts can lead to significant improvements in health outcomes. So that's one of the functions of organizations like CAHN and also organizations like Kidney Care UK and National Kidney Foundation. So what are the take-home messages here? So the take-home messages are: one, CKD, cardiovascular disease, diabetes, and hypertension are all very common and are interrelated. And so lifestyle, poor diet, lack of exercise, tobacco abuse, excessive alcohol, and significant risk factors. So prevention is the key, no matter whether you're a man or woman who has kidney disease. So early detection and management of CKD is essential to slow the progression. And so you'll be working with your doctor to do that. And so women have peculiarities. And so there's a lot of misunderstanding between reproductive health and kidney disease. And so that can be made easier through these advisory groups and like Kidney Care UK and National Kidney Foundation, and even your GP. So health check with your GP is important to screen for and manage these diseases. So in conclusion, recognizing the unique challenges women face with kidney disease is essential for tailored management of the condition. And so it's essential for tailored healthcare solutions and also management of the condition. And so raising awareness about kidney disease helps in early detection and better management of their condition. But advocacy for targeted healthcare solutions can significantly enhance the health and well-being of at-risk women. And that's the essence of this talk today, just to be aware that women are more prone to chronic kidney disease than men. And so this is women's health and chronic disease. I've signposted to this information in Kidney Care UK. You get a lot of information where they talk about some of these things, and so that you can be better informed. Thank you for having me, and I'll now take some questions.
Thank you very, very much, Professor. Thank you. That was a really serious whiz through, because this topic can take a whole day. I understand the breadth and the extent of this topic, but we already have some questions from the audience. And the first one is saying, if kidney filters vitamin D, does too much vitamin D manage it? How do we manage too much vitamin D? It's hard to understand how much vitamin D a Black person should take. I supplement with 4,000 international units. That's one question. And then the second one, I think I should
let me just take one at a time. Yeah,
okay.
If that's all right. Now, I didn't say that vitamin D is filtered in the kidneys. Vitamin D is activated in the kidneys. So the substrate for vitamin D is made from the skin, and it goes to the kidneys to be activated by 1-alpha hydroxylase, and so it's an enzyme. And so what happens is that vitamin D is activated. So what happens when you get a kidney disease, that activation no longer takes place. So it's not as if vitamin D is filtered by the kidneys. The problem, the issue is that it is one of the channels of making vitamin D active. So if you have kidney disease, you got a problem, because we need to give you vitamin D to support your bone health. So you're saying that you're taking vitamin D irrespective of the fact that you have low vitamin D or high vitamin D. So what I would advise that go to your GP, check your vitamin D level, because they do it before you get yourself too much. If you want vitamin D, will raise your calcium in your blood, and that's not good for kidney stones.
Life is all about a balance. Thank you for that. How often should women get their kidneys checked, especially if they have a previous family history of CKD?
Right, that's a very good question. I mean, if you have a family history of chronic kidney disease, is that depends on the age, it depends on the type of kidney disease. If your kidney disease is caused by diabetes and hypertension, of course you need to begin to adjust your lifestyle to make sure that you don't, or you're not overweight, you're eating the right foods and all those things, and eating less salt. So you will look at the trigger factors now. So if you have family history of CKD, if your CKD is due to diabetes of the family member due to diabetes and hypertension, so that should give you a warning sign that look, I need to look after myself. But if it is due to a genetic disease, then it means that you need to see the doctor to screen you for the genetic disease. Like there's only one genetic disease that is common, that is common that causes kidney. It's called polycystic kidney disease. So if you have a family history of polycystic kidney disease, then you need to be screened as a young adult, from when you're a young adult. But like I said, if a family member has chronic kidney disease due to hypertension, then you need to begin to watch yourself, because you may have hypertension, which causes chronic kidney disease.
True. We need to watch ourselves before we wreck ourselves. And I think moderation is everything, and being proactive. Thank you very much, Prof. The next person is really thanking you, Professor. Person says, thank you very much for this session. I didn't know kidney disease was this common. So thank you. We accept the thanks on behalf of CAHN and Professor, and CAHN and Professor. The next one says, how often would you recommend getting your blood test to monitor your kidney function for young women who are less than 35 years of age?
Yes, I mean, if you're young and healthy, and you don't have any family history of hypertension or diabetes, I don't think that you should begin to fret, because even the GPs, the way funding is in this country, they will not listen to you. So you must have those risk factors. And then but if you're above 40, then they'll do with the well woman and all those stuff. But when you get to 50, it's a must. So those are the things but if you have risk factors within the family, there is family history of diabetes, hypertension, that is something that you should raise with your GP. That look, there is family history or heart disease or something because of all this. I need to be checked out.
Yes, and that's why we say knowledge is power. That's why Prof is actually giving us all that knowledge this morning to say, go to your GP if you know you have a family history, and say nicely, GP, I've got XYZ. My dad had polycystic kidneys, or my mom had ABC. I need to be screened, irrespective of your age. Next person is asking us, what color should urine be?
I mean, urine is amber color. I mean, look like this. It's not a silly question. It's a good question, because a lot of patients that have come to me, they said, "Oh, doctor, my urine smells very strong." Of course, it's going to smell strong, because if it's concentrated. I mean, if you just drink 2 gallons of water or 3 gallons of water, I mean 3 liters of water, you see that your urine is more dilute and the color faints a bit, So it's golden, some form of golden yellow color. But I'm not very good with describing colors, but it has that. I don't know whether Loretta will help me here.
I will. I will
Okay.
help you. So ideally, it should have that sort of amber color,
Oh yes,
golden
amber. Yes.
yellow,
Yeah.
depending on the concentration and what you eat,
Yes.
important.
Yeah.
If you eat a lot of beetroot, of course,
To be
Prof has told us how the kidneys are golden. They are going to filter that red color as well. If you take certain medications, they are going to smell in your urine, and they are going to color it as well. But in the absence of any of those things, it should be nice amber yellow, not too dark, not too light, but it can become very light when you drink a lot of water. So, and depending on where you are, or if it's winter, if it's summer, if you're in the temperate region, if you are sweating and losing water through other means, your urine can also become concentrated. Anyway, that was an interesting question. Thank you for that question. So Bisola is asking us, you mentioned women benefit from hormonal protection for the progression of CKD. This would suggest that peri or postmenopause estrogen level replacement for non-CKD women patients should be a standard recommendation, regardless of if they have severe menopausal symptoms or not. I think what this person is saying is that you said that the progression in women is not as bad as in men. So are you not advocating that in the menopause, the women should not start being like men and that estrogen should be replaced for all of us to stop progression of CKD?
No, I think you got the whole message wrong. I mean, the message is not the way you've put it. I mean, what I was saying was that that's what data shows, that epidemiologically, that men end up on dialysis less, but women have more CKD. So those are two things. So women have CKD, but it's slow progression. Nobody knows why. It's possible that it's hormonal protection. Nobody really has done research to say that that is the case, but that's his postulation. But that doesn't to say that because that is the case, everybody should be giving estrogen because so that you want to slow progression. Of course, we'll have be giving estrogen to all our patients so that they will not be progressing, but that's not the case. There's not been any definitive evidence that estrogen protects you from progressing in your kidney disease. But one thing is very sure that women have more CKD than men because of the things I've highlighted. One, they are more prone to autoimmune diseases, they are more prone to urinary infections, and they get pregnant and all that. And those are some of the things that affect them. So those are the things that I think the message should be very clear so that you don't misinterpret it.
Yeah. And to be honest, in pregnancy alone, the challenge of the kidney is massive. The blood volume is going to increase. The kidney is going to feel tired.
Hyperfiltration, yes.
Yes, the weight of the baby on the organs, even the kidney, and the general effect of progesterone, which makes all the vessels to just go a bit floppy, means that the kidney has a lot more reason to have urine backed up and expand. So you have hydronephrosis, and when the flow of urine is slow, you then have stone forming, infections happening. So you have nephritis as well, and then you have urinary infection and all of that can affect the kidney. Yeah. And let me say it here today that UTIs, urinary infection, is one of the commonest cause of preterm labor in women in pregnancy. So it's a chicken and egg sort of situation, and that's why our kidneys are very, very precious. If you have any kidney issues, please see your obstetricians pre-pregnancy and plan properly. Yeah. Someone is asking us, Prof.
Can I just say, So, I mean, I just wanted to mention the hydronephrosis is when there's back pressure to the kidney, so the kidney gets bigger. So that's what we mean by hydronephrosis, so that you don't get confused. And when she said nephritis, I told you nephritis is inflammation of those filters. So that's what you should know. All right.
Fantastic. Someone is asking us, I might have heard wrong, Professor, but did you say check your kidney every day? If so, how do you check your kidney yourself every day? I have had CKD now for years and I get checked every year.
Yeah, I know. I didn't say every day. Nobody checks.
So how do you check your kidney every day?
No, there's nobody that checks their kidneys every day. So what you do, I mean, our patients, depends on your stage of kidney disease. We either see you every year, or we see you every 6 months, or we see you every 3 months. And so, depend, like I said, from the stages that I showed you, if you're on stage 3, I will see you every 6 months. Stage 2, stage 3, and every year. But if you're stage 4, we'll probably see you 6 months, 4 months, or 3 months. Depends on other risk factors you have. So we don't do kidney tests every day. Then your GP will run out of money.
Well, informally, you should please stare at your urine every day.
No, I mean, looking at your urine every day will not be of any use to you, will it?
Just be your urine aware. Anyway, that's on the lighter side.
I think the thing is that if your urine is very concentrated, you will know because it smells strong and all that. And when you have a urine infection, it begins to smell bad. you will know. Yeah, and you also have some irritation and some stinging when you're passing urine. Yeah.
Yeah. Iyabo is asking us, and some other person, I think they may just have joined us, Prof, because you've actually talked about this, but you can just do a quick recap. Iyabo is saying taking vitamin D daily. What quantity of vitamin D is appropriate? And Adela is asking, what are the signs of the kidney not being healthy? These are things you've touched on before, but maybe you just run quickly through it again.
Yes, I think if you came at the beginning of this talk, you will have known when I talk the kidneys in health and in disease. So you'll have seen that. So I'm going to go through that all over again because there are quite a number of slides for that. And you can go back to the recording. Yes,
yeah, they can watch it
later. Now, taking vitamin D, I need to hammer that because your body, normal person will produce normal vitamin D. Now, in the UK, during winter, there's less sun, so people have some marginally low vitamin D, so but it doesn't cause any problems for them. But there are some people that, especially in the Asian population, they are more prone whether because of their diet or whatever, they have low vitamin D, then you can take it. I mean, the average, if you're taking vitamin D, they shouldn't take more than 400 units per day. That's what the supplement on the shelf in Woods or any of these pharmacies will show. If you just take it, I see the vitamin D content is about either 400 or 800. You shouldn't take more than 800 units. So it's not advisable to take vitamin D on a routine basis when you're eating well and you're fit and well. But in certain situations, especially in some ethnic minorities, they have low vitamin D, and so people just go and buy it off the counter. 400 units will not cause any problem for you, or 800 units. But taking 4,000 units, that's a lot per day.
Okay. Then there's a question here that says, why do children and teenagers have kidney failure? Prof, you come to that. But somebody has just asked me, and I think I should put this out there as well so that Prof can chip in. What contraceptive is good for women with CKD if hormonal ones may not be acceptable? And to that, I've just said use the non-hormonal ones like copper. Copper intrauterine device is something that we advocate. So, Prof.
Yeah, I mean,
yeah, go on.
In terms of contraception, look at what we'll do. First of all, we don't advocate pills because of its effects on blood pressure and clotting. So what we'll do is that we always signpost you to the gynecologist. We don't take the decision on what you should get, but we do tell the gynecologist that know that this patient has high blood pressure, know that this patient has a high risk of thromboembolism. So when they have those information, they will be able to advise appropriately what contraception.
Just like we've done now.
Yeah. So she has already advised that she works with nephrologists all the time in looking after women and all that.
We do. We have the specialist obstetric renal team, MDT. Somebody also asked us, why do children and adolescents have kidney failure, kidney disease?
Now, children and adolescents, usually most times their kidney disease is congenital. If you get, I mean, it depends on the age of the child. So if a child newborn and early infants and then young child, most times it's congenital, and most things has to do with structural malformation of the kidneys. Sometimes they have maybe the lower urinary tract, they have posterior urethral valve, and some of these congenital malformations. Now, there are some diseases like in early adulthood, especially in Africa, where somebody may have what we call post-streptococcal glomerulonephritis and all that. And so, which is when you have a sore throat and the immunological kind of interplay between the kidney filter will now get inflamed and all that. So that's what happens in children. But most young children, kidney disease is congenital.
Thank you very much. Someone has sent a message to my WhatsApp directly. Shout out to all those watching from other places across the world. They want to find out the effect of salt plus or minus monosodium glutamate on the kidneys. I
I
think
mean,
monosodium glutamate are seasonings that you find in things like when we're growing up, what they used to call white Maggi, Indomie, spices, those kind of things. Yeah.
I mean, the fact is that, for example, people use all sorts of spices. I mean, if you go to the Indian restaurant, they have loads and loads of spices in their foods. And so one of the things I always say is that, most of the spices they put there are very little. They don't make any much difference. But the area that I am very concerned about are spices that contain a lot of sodium. So sodium itself causes volume expansion, which is its salt attracts water. So you're likely to worsen your blood pressure if you have too much of salt. So that is the main message. And so it's a risk to your kidneys when you have more salt, volume expansion, high blood pressure, and it damages your kidneys.
Thank you very much, Professor. I think those
There's
are the
somebody
questions.
there's somebody that's talking about what about 2000 vitamin D a day? I said between 400 and 800, 2000. Look at what happens. If somebody is vitamin D deficient, that you have very low vitamin D, say in 10 or 20, your blood level, what we'll do that we'll give you an induction therapy, which it goes in thousands. And after that, we stop and check your bloods to see your vitamin D level. You can't just nilly-willy just go to the shop and just be taking vitamin D and of what value is it to you? Because vitamin D actually is for bone health. And there are other metabolic things that it does, but mainly it does for bone health. And so that's what I would advise.
All right. Thank you very, very much, Professor Ibi Erekthima. Thank you so much. You have indeed shown us that you are the global kidney health facilitator with all of the experience to compress this very broad and diverse topic into 40 minutes. And thank you for those who have also been here today, spending their Saturday gathering knowledge, which is wealth. We'll be handing over to Hayford 24 now to do the closing formalities and the needed announcements. Once again, happy International Women's Day. Keep your kidneys healthy. They are two precious bean-shaped organs that God has given to us. Keep them healthy. Do everything in moderation. Thank you, Prof. Thank you so much.
Thank you. Thank you.
Thank you so much, Dr. Loretta and Professor Ibi. It's been very insightful. And I believe, most of the women that have joined today and you join every weekend, we really appreciate, the work, you are doing in helping to support CAHN. And it is one of the best days of the year. So once again, happy International Women's Day. I believe the sun is shining, in some parts of the UK. Definitely go out, have fun with the family. It's very, very important. Can we, go through some of our exciting events that are coming and some of our weekly and monthly programs? I hope you can see my screen. Yeah, so next week, we're having once again, our health hour. Dr. Edmond Edi Osagi, will be joining us same time between the hours of 11 and 12. And it will be about endometriosis, treatment and special surgical options. Please let's join as we do always. And I believe we will pick something throughout that session as well. So ending of this month, we are in Queen Elizabeth II Conference Center. It's the Black Health Inequalities Summit. Last year, it was a great time. And I believe this year we have Professor Bola Owolabi, Professor Kevin Fenton, CBE, Professor Habib Nagvi. We have Paulette Hamilton, MP, Solly Warren. There's so much that is happening, in London on that particular, time. So please register, and we need to come together to make sure that, the health inequalities that is within our communities can be dealt with, and there will be major improvement. So the Black Health Inequality Summit on the 26th of March 2025 is going to be an exciting time. This particular Sunday, just tomorrow at Manchester Cathedral, is our day of reflection regarding COVID-19. It's been quite some years now, and this is an opportunity for us to meet between the hours of 7 p.m. to 9 at the Manchester Cathedral. It's a time of reflection. We're coming together in hope, to remember and to reflect, over the years, what has really, happened regarding COVID. And I believe, the gates of Manchester Cathedral is open for all. Let's come in our numbers. Let's come and support. Let's come and reflect. And I believe we will learn something after that particular event. So CAHN has a series of projects, and one of them is the bereavement support group. Have you recently experienced a loss or dealing with grief? We have a free online bereavement sessions for families and individuals. And, the first session will be on Monday, the 10th of March, 7 p.m. to 9 p.m. You can register, with a QR code, or you can contact Rosalind at rosalind@can.org.uk. We do quite a lot, of support, especially within our community, when it comes to, people are grieving. If you need any support, these are key things that we need, because as a community, we need to support one another. And that's what CAHN is here for. The next one is Delivering Equality Summit, which is on the Friday, the 14th of March. It's from 10 a.m. to 4 p.m. at Whitworth Art Gallery. And, this is, everyone is invited. If you want more information, you can please go to events@can.org.uk. It is a time of discussion, where we're going to discuss about maternity inequalities, which is very, very, very serious in our community, and the impact that it have on maternal health outcomes. So the Delivering Equality Summit, which is Friday, the 14th of March, 2025 at Whitworth Art Gallery. Yes, we are back again. It looks like the month of March is quite, packed with a lot of activities. London is busy. Manchester is busy. We have Shiro again, Black Women Shiro Journey, which is, in regarding International Women's Day. So we are celebrating, our wonderful women in London. The entrance is free. We want you to join us for an empowering and an inspiring event. There'll be doctors, nurses, health professionals sharing insights on sexual health, the Black heritage, everything that has to do, with our health. Just like today we've learned, just like next week we'll be learning, is all about making sure that we all come to the place where we have the knowledge and the understanding to be able to help one another, especially within our communities. So on the 15th of March, between 12 p.m. to 5, the location is the Lambeth Town Hall, and registration is free. Please reserve your seats. The contacts are Bumi and Judy, and if you need any more information, it is on all our social media platforms, and you can get every detail, and you will not miss such an opportunity. So let's gather in London on the 15th. So finally, I think we have our legal drop-in sessions. The next one is on the 27th of March. If you're thinking about writing a will, you're not sure, we travel, across, we come and settle in the UK. We are so busy. There are things that we don't really, have the time to learn. CAHN is making all these things available for us. On the 27th of March, 2025, the time is 6:30 p.m. It's online, so you can relax at the comfort of your home and join so that, you can learn. These sessions help us. Knowledge is what we need. So, when should you write your will? The importance of protecting your assets, estate planning, benefits of having a lasting power of attorney. Don't miss it on the 27th of March. Thank you for joining today, and we hope to see you next week. Enjoy the sunshine. Have a wonderful weekend, and see you all next week. God bless you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.